Hello everyone, and today especially hello to women, since Diastasis Recti mainly affects women. A few words briefly about the Diastasis Recti. It occurs mainly during the pregnancy and will be felt in postpartum. During the pregnancy, the rectus abdominis muscles, that are in fact a pair of muscles, known most commonly as the six packs, they lengthen by 15 centimeters to make room for your fetus to develop. And then it will take 6 weeks after birth for them to return to their initial length from before the pregnancy. But still there will be loose and weakness will be felt in the center. So in the center of your six packs abs and along the entire length of the muscle from your sternum to your pubic bone, you have this white line. This is relatively strong connective tissue, but still enough flexible to allow your belly to grow during the pregnancy, of course, and it's resembled to a tendon. You know, all the abs muscle, in fact, have this kind of extension. The shape of the extension will depend on the shape and the size of the muscle, of course, but all of them meet in the center. So how do you know if you have a diastasis? Recommends first of all to check with the pelvic floor physiotherapist. This is their job. They are professionals. They will know how to assess your diastasis and also to check your pelvic floor. So don't give up on the test. This is really very important. But still you are curious to feel that alone. You want to feel your diastasis and check if you have one. We can do that together right now. So we are going to lie on our back, but sliding from the side because you don't want to aggravate your diastasis just for lying on your mat, yes? So exhaling, we're going from the side, rolling to the mat, and then we're going to check. So we're going to do it one time because we're going to do a crunch. And you know what I think about the crunch maybe. So I am lifting my head, raising my head on my shoulders, and this is the best position to check your diastasis. So you can feel and touch with your finger on your white line and see, and if your fingers are coming in 2.5 centimeters or more, this is a sign that you have a diastasis. But really, don't panic. It will mostly close by itself with the time. But of course that you can have some very good exercise, and it's be recommended to have some good exercise to close this diastasis and not just wait. And just a moment, what we did on the mat, if it's an exercise to check your diastasis, it cannot be the one to strengthen your abs and close the diastasis. I hope I make my point about this one. So yes, we can have some specific exercise to close the diastasis, to sculpt our abs, and here I come to the heart of the matter, the one that makes me turn to you right now. I see so much exercises for diastasis on the network, but unfortunately, they are missing a very important principle in order to be safe, secure, and efficient exercises and not aggravate your diastasis. So what is this principle? According to the doctor, the Gasquet Method, and believe me, there is some scientific research behind it, you will need to keep the lengthening of your spine before entering any exercises. And keeping the lengthening of my spine, it's not just when I'm sitting, it's also when I am standing, when I am lying on my mat, on my side, on all four positions, and every posture. So how are we going to do that? And yes, I want first to ask you a question. When you want to close the zip of your jeans, you stretch it first, yes? You understand this point? So this is so logic. So you will need to keep the lengthening of your spine before working and closing your diastasis. You don't want to fight to try to close when everything is open, wide open. So I invite you to try something with me. Sit on a chair or maybe on your yoga mat. Find a posture that you can easily keep a straight back. And now I invite you to check again in the middle of your white line. Maybe you discovered some point before, some point of weakness, and then collapse into your posture and feel what's happening to this point. And now we are going to lengthen the spine. So place your free hand on your lower belly. We are going to contract first our pelvic floor muscle. Why? Because this contraction of the pelvic floor muscle, previous to the exhalation, will pull in our tailbone. So it's the starter of the lengthening of the spine. So my second hand is on my weak point, approximately, and then contract your pelvic floor muscle. It's like returning the knee. Exhale to the mouth, chin a little bit in, top of the head up, and stop your breath for a moment and check again this point. Do you feel that it's like more close? I hope I make my point there. And I almost forgot to tell you something. If you have a correct and deep exhalation with the lengthening of your spine, you are doing half of the job. And why is that? Because all those abs muscles that are enveloping your six-pack, they work and contract with the exhalation. So yes, if you have a correct and deep exhalation, you are doing half of the job. So if you want to discover safe exercises and efficient exercises to close your diastasis, sculpt your abs to the way to a flat belly, and I think every one of us is dreaming of flat belly. I invite you, every one of you, with diastasis or with not, and it's good for everyone, to join me right here on the mat. I am waiting for you. Thank you.